Hey, it's Dr. Karen Can, and I'm doing another LifeWave Tips video, a LifeWave micro training. And just so you know, all of these trainings will appear on the YouTube channel afterwards, and you can go to patchtrainingteam.com/micro training to check out all the past archives of everything that we've done here. So I have been requested by folks that are in the group, in my Facebook group, which is the LifeWave Patch Training Team Support Group, to do a video on head pain. Now, one of the reasons we don't call it headache or migraines is because, that's a diagnosis and has a medical code associated with it. And LifeWave does not purport to treat, cure, or prevent any disease or illness, especially diagnosis. So we wanted to be very clear that we're not curing or treating anything. We are actually treating, well, we are treating something. We're treating a symptom. We're not treating the disease. So we're treating the symptom of pain. So if you have pain in the head area, okay, I'm going to show you one of the advanced protocols that you can try to help with that. Now, one of the first things you need to know is that hydration is very important, not just for head pain, but just for energy to move in your body. And what we want to do is move energy past blockages, because in Chinese medicine, any pain is due to some sort of blockage in energy. So today's demonstration, we're actually going to be using the IceWave patches. So these are two patches, a tan and a white. They are to be used in conjunction with each other. And when you open the package, there's actually a divider in here. So some people that are brand new as customers or distributors actually don't realize there are two patches, a white and a tan. So definitely you need both for this protocol to work. So you want to grab, a white patch, and then you also want to grab one of the tan patches. And I highly recommend that you hydrate with at least 16 ounces of water prior to testing these out. Because what we're going to do is we're going to test out different acupuncture points to see which one works best for you. And the nice thing is, if it's going to work, it's going to usually work within 10 to 15 seconds. Sometimes it might take as long as a minute, but most of the time it works that quickly. So what we're going to do is have you take one of each patch. Okay, this is my right side, by the way, one of each patch. And we're going to have you put a curl of tape. So I'm just using regular Scotch tape here. So I'm just going to take a piece of tape, or two pieces of tape here, and I'm going to just make a nice little curl here. One of my distributors actually used packing tape, and it was like this big, and it was impossible to get the patch off of it later when she had to adhere it to. So she just put the whole darn thing on her neck because it worked so well. Anyway, so I've got a curl of tape on the back of the white one and on the back of the tan. Now, what you want to do, I'm giving you a little tip here, is you'll see it scored on the back. And so I'll put the tape on the bigger side, if there is a bigger side, and just on one side, because it's easier to take off rather than when you put the tape across the the scoring here, because we're gonna use the patches with the tape on to move them around until you get the best possible result. So what we're looking for head pain, or any pain really, is at least a 50% decrease in pain. So what does that mean? So if you are 10 out of 10 in pain, we are looking for a 5 or less. Okay, a 5 or less. And what you want to do is try each of these points to see if you get a better result with some of them versus the others. So right now we're going to stick with the IceWave pain relief patches because they are known for pain relief. That is what they are made for. All right, so and if you are watching this live, if you want to put some questions in the comments, please do. And then if you are watching this as a replay, just type in replay. That'd be really helpful. Okay, yes, so John says, I have excruciating head pain right now, and you just popped up on my feed with this. Thanks, Spirit. I guess I'll pay attention. Wow. Okay, yeah, I guess so. Quite a synchronicity. All right, so what you're going to do is take the white patch in the right hand, the tan patch on the left hand, because this is going to be the side you're going to put it on, okay? So now, it doesn't necessarily matter where you have the head pain. I would try all of the points I'm going to show you today to see which set works the best. So remember, you got to drink 16 ounces of water first to hydrate. And then the first place I'm going to actually show you from top down because it's easier to remember that way. So you're going to put the white on the right side of the temple. Oh, sorry, not the temple, the forehead, and tan on the left. Now, this looks completely ridiculous. If you go to the grocery store, people are going to be like, oh, what's wrong with your forehead, right? Yeah, so I often tell, my team members, I said, well, it's great for if you want to sell something. Because people will be like, what's that on your head, right? But in this day and age of COVID pandemics and everything, anything pretty much goes. So they might not ask. Anyway, so what you want to do is put this white on right, tan on the left, and rate your pain again after 10 to 15 seconds. You usually don't have to wait that long because light, this is phototherapy, so light works very, very quickly. Just like, when you turn on a light switch, you have to wait 10 minutes for it to go on. No, it's pretty much immediate, right? So it can work that quickly. It just depends where the blockages energetically are as to where the positioning of the patches will work best for you. And everyone's different. So that's why you have to play with these. And it's completely okay to just play, try things out. Now, one of the tips I want to give you is that if any of the placements makes the pain worse, okay, you know what you do? Okay, if it makes it worse, you reverse the colors. Yep, that's it. Because the energy just wants to go, one way versus the other. And that's an easy peasy fix. Okay, so we're going to go back to our white on right, tan on left, because that's normally how we start, white on right, tan on left. So here, so after 10 to 15 seconds, say you don't have a huge improvement, okay? You went from a 10 to maybe a 9 or whatever, okay? Not that impressive, right? So next point we're going to try is on your temples. So go ahead and some of you intuitively will know like where on your temples you want to put it. So it might be further back because there's like, oh, muscle tension there. Or you can put it right next to your eyebrows or right next to your eye. Okay, don't worry about what acupuncture points it is. So in this case, I got white on right, tan on left, sticking with our usual polarity there. So after you've tried this again and you're hydrated, wait 10 to 15 seconds and then re-rate your pain to see if it's any better. Okay, so keep going because you're going to try all of them unless, of course, the first one gives you 0 pain and then you can stick with that one and take the sticker backings off, take all the tape off, right, and stick them right to your head. But assuming that doesn't happen, or I want to show you the whole advanced protocol, all the different things you can do. So that's temples, right? Okay, next one is a lot of people have head pain due to an imbalance in the temporal mandibular joint right here. Okay, so you might get popping in the jaw area. There's a joint here, and if you push on it right in front of your ear, might be a little sore. Okay, so that could in and of itself cause head pain. So what you're going to do is just put the ice wave right in front of the ear. Yep. So let me turn so you can see white on right in this case, tan on left. Okay, and of course I'm running out of stickiness. So that'll happen when you're using Scotch tape or masking tape. So you can always take some more tape and tape it on top of the curl of tape you already have. Doesn't really matter if it's on one side or the other. And to answer your question, yes, the patches still work even though the paper backing is on. It's light. It's infrared. It goes right through paper. And they turn on when they're close to your body and they turn off when they're away from your body. So you don't want to be carrying a whole package of patches around in your pocket all day because you'll just activate them all. Okay, so we've got the temporal mandibular joint, right? Okay, so that is one of the common areas causing or contributing headache. Now, the other area I want to show you is actually the neck. So a lot of people have tension in the neck. I did another video on the scalene muscles, which tend to be, there's 3 groups of and that tends to be really tight in a lot of people, especially if they sit at the computer a lot like I do. So you can actually just put it on, the muscles on the side of the neck. Again, start white on right, tan on left. If it gets worse, switch the colors. Wait 10 to 15 seconds and see if that makes a difference. Okay. Now, you're like, well, but which muscle? Doesn't matter. Just put it somewhere and just check. Is it better or not? Now, if you think, oh, that's better, you can tweak it a little bit, move it up a little bit, go, no, that was worse. Okay, so move it back a little bit, a little further back. oh, maybe that's better, right? Or you can move it in the front because there's different muscles of the neck that could be contributing to pain and discomfort. So you can play with these. So there's no absolute right or wrong for every individual is different. Okay, so after you've done the neck, one of the other places you may want to use is actually on top of the shoulder. A lot of people have shoulder tension that could literally, through the fascia and the muscles, pull on the head. So you can literally put it on the highest point of your trapezius muscle here. Now mine are getting pretty beefy because I'm doing CrossFit. So, right. So right on right, hand on left, and see if that helps. And the last place I wanted to show you that's in and around the head area is actually a spot that is called Gallbladder 20. So I don't know if you'll be able to see on my little doll here, my little acupuncture doll, but this is the front of her, okay, and this is the back of her. Gallbladder 20 is on the back of the head, and it's back behind where the neck muscles attach back here. There's a little divot right underneath the skull, and usually it is a little bit tender. So if you're not sure where it is, you can look it up online and just put acupuncture point gallbladder 20. So this one right here is actually gallbladder 21. So I'm going to put it back here, and I don't know if it'll stay, but let's see if it'll stay here as I turn around. And these are wind points, and a lot of people will get stiff neck when they've been exposed to wind, cold. When it's windy, I know I have in the past been susceptible to excess wind. So this point is great if I feel like I might be coming down with something. There's a little nasal drip, or I feel a slight scratchiness in my throat. I immediately put patches, could be energy patches in that case, or ice wave on this wind point, gallbladder 20, to kind of kick out that excess wind. And so if that's the case, you have neck stiffness, it might be good to actually put it on gallbladder 20 here to help to get rid of that excess wind. I know that's a Chinese medical diagnosis. It does not mean you have extra farting. It just means that you have wind that penetrates your meridian channels and could make you sick with cold symptoms. Okay, so I'm running out of sticky again, so I'm going to yet put another layer of tape to show you the next part. So the next part, we're going to use a very, very strong point that is known for all things related to the head to help balance it, and it is called large intestine 4. So large intestine 4 is right here. So one of the ways you can do it is actually squeezing your thumb close to your index finger, and you see where there's this height of this muscle. This is called what muscle this is called? Sorry. Sorry, just like lost it. Anyway, so this muscle right here, I haven't had to take an anatomy test for many years. Anyway, so this muscle right here, where it's the height of it, that's large intestine 4. And if you even squeeze it with your, thumb and forefinger, most people, it's going to be tender and it hurts, but now you can squeeze this a lot and it may help your pain, except that you can't squeeze, for hours on end, right? So that's where the patches come in really handy. So what you're going to do is you're going to patch the white. This is my right side. You're going to patch the white patch on large intestine 4, and then the tan patch on the left, large intestine 4. See that? All right, so here we go, both of them. And again, wait 10 to 15 seconds, see how that works, and see if that helps your pain. So this is one of the strongest points, and this is really great for anything in the head, including dental issues, sometimes sinus symptoms, teeth symptoms like pain. Large intestine 4, in addition to helping the gut, of course, it's large intestine, is really, really helpful for anything in the head and neck area. So worth a try, right? So we're just going to review those points before I go to my other tool I want to show you. So you've got here on the forehead, right? You've got on the temples. You've got in front of the ear over the temporal mandibular joint. Say that 3 times fast. Okay, TMJ. You can even put them here on your masseter muscles, although that's not as common cause. A lot of people put it right on the joint. in terms of head pain. Then you're going to try it on the neck. You know, if it's helpful, put a little back, put a little forward, see what works best for you. Top of the shoulders, gallbladder 21, okay, especially for tension that causes head pain. And then on the back of the neck in the little divot, okay, on either side, which is very, very lovely to massage, is gallbladder 20. That's gallbladder 20, and this is gallbladder 21. So gallbladder 20 is really helpful for kicking out excess wind that can cause stiffness and pain in the head area. So now I want to show you my other little device here that I have, and I will put that in the comments or description rather, so you know where you can get it. It's called the Fascia Blaster. Okay, now this is called the Face Blaster, and if you're watching this live, in a few days they actually have a 50% sale or something like that. Anyway, so great sale on these. So wait till Wednesday the 25th to get it. So this is really great because it helps to loosen the fascia that might be causing or contributing to the tension in the head and neck area. So this is a really good thing to do in between patching. So I'm a big fan of this. I've been using it for the face and the neck and, you know, back of the neck and, you know, around these scalenes, things like that. And in the shower, it's been really great to like scrub with the conditioner on or soap on, whatever. It doesn't get tangled in the hair, you know, just very, very short, back and forth, back and forth, back and forth, up and down, up and down. Very, very short strokes. You don't want to do long strokes because then you're going to cause a lot of tangling, right? So short strokes, back and forth, back and forth. And at first you might find it's really, really tender. And then you know that you have a problem in that area. I was doing some jaw exercises with my jazzercise, and I was literally, you know, doing this right over that TMJ area. Oh my gosh, that was sore. And I was like, okay, note to self, when in tension, it's even sore. So use it in the shower when you have conditioner or soap in, so it's easier to get to your head. If you're using it in your face, this is not a face blasting tutorial, but if you're using the face, you're going to need to use some sort of oil, you know, to make it slippery. And if you are not in the shower, what Ashley Black, the inventor of this Fascia Blaster, says is put it in a baggie. So she puts it in a baggie, and therefore they won't get tangled, and you can go ahead and scrub, 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 scrub. Now I find it's not as, you know, it doesn't feel quite as good or releasing as much as in the shower. So I prefer to do mine in the shower. But this is called the Face Blaster. And I'll just put it in the comments here as well, where you can get that. I am an affiliate. So love her stuff. So you can get it at karencan.com/face blaster. And yeah, you can use this, you know, to help release the fascia in the face as well. They actually come with some video tutorials. You can use, like I said, oil, but remember, you can actually also use it on your neck, you know, and it's really good to release the fascia, which may be contributing to the symptom of head pain. Yeah, so there you have it. That is the protocol for head pain using the Ice Wave patches. So if you are watching this on YouTube, you know, please subscribe to my YouTube video and give it a thumbs up. And if you're on Facebook, please put replay if you're watching this on the replay, and feel free to share it from any of my public Facebook pages like lifewavepatchtrainingteam.com or drkarencan.com. Those are all public, as well as my personal profile. So you can share this away, and if you happen to be referred by a LifeWave distributor or consultant, you can go back to that person and find out how you can get some patches for yourself. And if this is helpful, please comment below. All right, until next time, bye for now.